So now we'll discuss questions, and I'll show you the screen of the questions, and you can just read the question and tell me the answer. A patient admitted to the emergency department, injuries and broken femur from a motor vehicle accident, and the patient is pale, diaphoretic, and not talking coherently. Vital signs upon admission: temperature 36, heart rate 130, and respiratory rate is 43, and BP is given 60/50. And the healthcare provider suspect which type of shock: cardiogenic, neurogenic, distributive, and hypovolemic. You can drop your answers in the chat box. Yes, exactly. It is hypovolemic shock. Okay, very good. Next question. A 28-year-old male is recovering from moderate concussion following a motor vehicle accident 2 weeks ago, when he suddenly develops an increased thirst, craving cold water, and the patient urinates very large amount of dilute water like urine with a specific gravity of 1.001 to 1.005. And the patient is most likely developing diabetes mellitus, diabetes insipidus, hypothyroidism, and thyroid storm. You can just drop your answers in the chat box. Here, the meaning of the question is: patient had a motor vehicle accident and there was a concussion in the head. And following that, the patient has started increased thirst, craving for cold water. That itself is indicating that dehydration in the body, and the patient urinate large amount of diluted urine. So urine excessively, the patient is urinating, and it is considered as a diluted urine, and specific gravity is much lesser. So what can be the reason? Diabetes mellitus, diabetes insipidus, hypothyroidism, and thyroid storm. Yes, exactly. What is the answer? Yeah, the answer is diabetes insipidus, not diabetes mellitus. Don't get confused. Diabetes mellitus is a condition where carbohydrate metabolism alters as a result of deficiency of insulin. ഇൻസുലിന്റെ അളവ് കുറയണോണ്ട് ഷുഗർ കാർബോഹൈഡ്രേറ്റിന്റെ മെറ്റബോളിസം ഓൾട്ടേർഡ് ആയിട്ട് ഹൈപ്പർഗ്ലൈസീമിയ ഉണ്ടായി. ആസ് എ റിസൾട്ട് ഓഫ് ഹൈപ്പർഗ്ലൈസീമിയ എക്സസീവ് യൂറിനേഷൻ ഉണ്ടാവുന്നതാണ് diabetes mellitus. Whereas in diabetes mellitus, specific gravity of urine will be almost normal. Okay. അതായത് സ്പെസിഫിക് ഗ്രാവിറ്റിയിൽ ഒരു മേജർ ഫോക്കസ് ഡയബറ്റിസ് മെലിറ്റസിൽ വരുന്നില്ല. But diabetes insipidus is a condition where it is caused by deficiency of ADH, antidiuretic hormone. Okay, antidiuretic hormone or vasopressin എന്ന് പറയും. So antidiuretic hormone in the deficiency കാരണം, antidiuretic hormones are normally acting on the renal tubules and it is helping to absorb more water. Fine. But because of deficiency of ADH, there won't be any action on renal tubules. As a result of that, renal tubules reabsorption of water is not going to happen properly. As a result of that, whatever we drink or the entire water get excreted as urine or through the kidney. Okay. അങ്ങനെ ADH ന്റെ ഡെഫിഷ്യൻസി കൊണ്ടുണ്ടാവുന്ന കണ്ടീഷൻ ആണ് ഡയബറ്റിസ് ഇൻസിപ്പിഡസ്. ഡോണ്ട് ഗെറ്റ് കൺഫ്യൂസ്ഡ് വിത്ത് ഡയബറ്റിസ് മെലിറ്റസ്. ആൻഡ് പ്ലീസ് നോട്ട് polyuria is expected also in diabetes mellitus and in diabetes insipidus also. But what is the peculiarity? The specific gravity of urine is much less as a result of dehydration. That is expected in diabetes insipidus. Okay, so that is the difference. Okay, how do we differentiate between these two things? And next thing is, already in the questions they specifically mentioned that patient had an injury on the head, and following that all the symptoms was started. Fine. So pituitary gland is producing, the posterior pituitary gland is producing ADH, and pituitary gland is situated in the brain. Okay, so you can just simply relate this. Clear? So the answer is not diabetes in mellitus, it is diabetes insipidus. Okay, any doubts, anyone? Those who have selected answer A, clear? Are you all clear, or do you want me to explain again? I think it is not necessary. Okay, okay, fine. And you are most welcome to ask in between the discussion any kind of questions related with any topic. Okay, it should be something related with the licensing exam. Okay, but I can assure you that I can give answer for everything. Okay, fine. And next is, the nurse has just administered insulin to diabetes client, and in which of the following ways should the nurse dispose of needle? This is like very simple. I don't want to explain anything more. Go through the option and select the answer. See, these questions are like very simple, and but you may get confusion. See, I won't answer from everyone, because everyone must be working in different agency. So the agency protocol, I can understand. Yeah. So two answer we got, like a burn the needle and discard in the red bag. In which agency this procedure is followed? Can anyone specifically tell the agency, name of the agency? I have not yet heard and seen that burning of needle. I have seen, but discarding in the red bag, I don't feel it is. Okay, C. And yeah, okay. C, needle and sharp should be placed in the nearest puncture resistant container. Yes, can be. Any other answer? Other answer? Shamsina's B. Needle should not be recapped. Yeah, that is good. And should be placed in a puncture resistant container, not just any biohazard container. Okay. So which one is the correct answer, C or B? So what B says is, needle should not be recapped and it should be placed in the puncture resistant container, not just any biohazard container. So it is like all these are included in a biohazards group. Fine. So very clear is, needle, not only needle, all the sharp should be placed in the nearest puncture resistant container. Okay. So better answer when we compare between B and C, the answer is C. Okay, next. The nurse is assessing a young adult pregnant client with no allergies who has tested positive for gonorrhea. Which of the following medication should the nurse expect to be part of the treatment plan? So, what is the choice of medicine for gonorrhea? So exactly the answer for any options other than D? Yes, everyone have selected D. Yeah, very good. So the answer is ceftriaxone. So those who don't know the answer, you can just learn the choice of treatment for gonorrhea is ceftriaxone. Okay. Next. An older adult client with a history of blood clot is in the emergency room with a suspected deep vein thrombosis of the left leg. The nurse starts IV heparin as ordered. Which of the following is least likely to be included in the care plan? Which one of this is included, least likely included in the care plan? Ampulation as tolerated, warm moist sock applied on the affected area, analgesics, anti-embolism stopping. What is the answer? Yes, answer please. So Wahida selected D. This is for this question or previous question?
This question, ma'am. Talking
So
salt.
what is the meaning of this question? Read the last sentence. Which of the following is a least likely to be included? Least likely to be included.
Okay.
Least likely to be included, which means which is not at all important. Anti-embolism stocking is important. Analgesis you can provide. A and B, I don't feel it's important. So, but you can't select two answers. You have to select only one. So you have to ask these two options that whether this option will kill the patient. Okay, so you just ask option A, ambulation as tolerated. When this patient perform any kind of ambulation, uh, would that cause any harm for the patient? And same you ask to B also. When I apply warm and moisture soak on the affected area, would that cause any problem for the patient? And in which question you got answer yes, then you can select that answer. Okay, everyone have selected B, and I'll just explain what is the effect of A and B on this patient. See, this particular patient is having DVT, that means clot in the major vessel, and patient is receiving anticoagulant. And okay, so when a patient who is receiving anticoagulant, because of the action of anticoagulant, the clot is literally detached from the wall of the vessel, and above all, if you perform activities, it increases the vascularity inside the body, and there may be chances to get dislodgement of that clot as a result of medication. And because of ampulation, that clot might dislodge and it will move faster and faster because your body is doing like active. So the blood, as the blood flows faster, the clot will also move faster and it will reach in the pulmonary. It first of all, it will reach in the heart, and then from the heart, it will be pushed to the lungs, and it may cause pulmonary embolism. And obviously, pulmonary embolism would cause a major problem for the patient. Yes, it will. Option A will kill the patient. Okay. And B, warm moisture soak applied to the affected area. Again, when you apply warm moisture, warm moisture application, it dilates the blood vessels. When the blood vessels are dilated, the blood supply will also increase. Even that will also kill the patient. Then compare between these two things and which of the following have the highest risk, ambulation or warm moisture soak. ആംബുലേറ്റ് ചെയ്യുമ്പോഴാണോ വാം അപ്ലിക്കേഷൻ കൊടുക്കുമ്പോഴാണ് ഈ ക്ലോട്ട് ഫാസ്റ്റ് ആയിട്ട് മൂവ് ചെയ്യുന്നത്? In which of these activities the clot will move faster? A or B?
Ambulation.
Yeah, it's ambulation. So what is the answer? This will be this will be the same situations you are going to face during your exam. So what you need to do is remove the wrong answer, and then if you get the last two answer, you have to ask each option. Would you cause damage to the patient? Okay, would this particular option will kill the patient? Yes, it will kill the patient. If you get the answer yes, you can select that particular answer as a first. Clear? So the answer is A. Next question. The nurse in the primary clinic is caring 68-year-old man. History reveals that the client has smoked 1 pack of cigarettes per day for 45 years and drinks 2 beer per day. He is complaining of non-productive cough and chest discomfort and dyspnea. The nurse hears isolated wheezing in the right middle lobe, and it would be most important for the nurse to complete which of the following orders: pulmonary function test, echocardiogram, chest x-ray, and blood test. Yes, drop your answer. Yes. Okay, it's chest x-ray. Any other answer? Yes, very good. It's chest x-ray. Very good. Okay, next question. Any doubts? If you want me to explain the options and questions, you can just again type in the chat box that repeat the question so I can explain. Next question. A child who ingested 15 maximum strength acetaminophen tablet 15 minutes ago is seen in the emergency department. Which of the following order should the nurse do first? Gastric lavage whenever necessary, and acetylcysteine, it is like antidote, and the dextrose 5% and activated charcoal as per agency. So the question is which of these orders should the nurse do first? See, when you get questions like this, which of the following you would do first? That means all these four options are necessary for the patient to care the patient, but one of the following is required first, and one of the following requires second, and another third one, which is for third option and fourth. Okay, so when you get this question like this, like which one is the first and what is the priority action, so for all those kind of questions, the entire four answer will be the answer. Okay, so നാല് ഓപ്ഷൻസും correct ആയിരിക്കും, but out of that one is the highest very important one. മനസ്സിലായോ? So you can select which one the nurse do first.
Ma'am, I don't understand the question. Please, can
So
you
here,
explain
yeah,
it?
sure. The child who is there in the emergency room who had 15 maximum strength acetaminophen. Acetaminophen, it is a tablet. Okay, so this child has injected 15 maximum strength of acetaminophen 45 minutes ago, and the child was brought into emergency room. And you need to provide all these options, all these interventions A, B, C, and D. And which one of the following option you have to perform for the first. You will just insert a nasogastric tube and start for gastric lavage. Acetylcysteine, it is mucomist. It is considered as a normal antidote for acetaminophen. And C is dextrose to keep the vein open. I don't feel that is important, starting fluid. So C is not the first thing. So C can be removed. And activated charcoal as per agency or as per pharmacy. Even activated charcoal we normally give if you don't know the exact antidote of a substance. But here in this situations, you know the exact antidote of the substance. So activated charcoal is also not necessary. Okay, so you can just remove that. Okay, so now the question is clear. B, I said, so
Yes.
A or B, yeah. C and D is completely wrong, and from A and B, the first priority is not antidote. Always the first priority is gastric lavage when necessary, and then if you get the correct order, then the correct and then you can administer acetylcysteine. Okay, so the initial thing is just inserting a nasogastric tube, and if you get the order for lavage, you can perform that. Clear?
Okay, ma'am.
Okay, so the correct answer is A. That is a primary first action, and then the antidote is B. Clear? And if you get that
Okay,
question
ma'am.
like this, what is appropriate intervention? So the answer will be B. But here question, they have just mentioned what is the first action. So then only the answer comes as A. Next. The healthcare team established new strategies that help in prevention of death among cases of certain disease, but these strategies do not prevent the occurrence of that disease. Which of the following measures reflect the expected outcome? So again, what is the meaning of this question? A healthcare team established new strategies that help in prevention of death among the cases of certain disease. That means with many disease, for example, if we take a corona, so because of COVID positive or corona positive, many people are died. Okay, so as for the healthcare team, they have just started a new strategy to prevent death among cases of certain disease. Disease can be anything, but what the healthcare team have decided or established, they have just established a new strategy in which they have just mentioned whatever or whoever the person who is infected with COVID positive, that is okay, but we are not allowing those patients to get die. Clear? So, but these strategies do not prevent the occurrence of that disease. Okay, so when you initiate the measures, the same kind of measures like taking measures to prevent the death, that is not going to prevent the transmission of disease. Clear? So which of the following measures reflect the expected outcome? Expected outcome is always a positive outcome. Okay, so when you initiate this particular strategies, what should happen? The patient should not die because of any kind of disease. If it is measles, let the patient get measles, don't worry, but because of measles the patient should not die. And influenza, based on these strategies, let all the people infected with influenza not a problem, but what is our goal? In the person or the group of person, they get infected with influenza, but they should not die. Okay, so based on this particular strategies, we are focusing to reduce the number of death. Clear? And we are not at all focusing on preventive measures. മനസ്സിലായോ? സോ ഈ ഒരു കേസ് അനുസരിച്ചിട്ട് നമ്മുടെ ഫോക്കസ് ഇതാണ്. നമ്മൾ ന്യൂ സ്ട്രാറ്റജി സ്റ്റാർട്ട് ചെയ്തതും ഇതാണ്. കൊറോണ വരാണ്ടിരിക്കാൻ നോക്കുന്നതല്ല, കൊറോണ വന്നിട്ട് മരിക്കാണ്ടിരിക്കാൻ നോക്കുക എന്നുള്ളതാണ് നമ്മളുടെ ഫോക്കസ്. That is what we are practicing now. We are not, nowadays we are not focusing to prevent COVID positive. We are focusing not to die because of COVID positive. Clear? So, based on this, what reflect the expected outcome? What is your expected outcome? Whatever the patient get infected with any kind of infection, but they have not died. Fine. So increase prevalence, decrease prevalence, and increase incidence and decrease incidence. So before selecting the correct answer, you should know what is prevalence and what is incidence. Anyone? What is prevalence and what is an incidence? Okay. So you can just write down prevalence and incidence. See, incidence, it is number of new cases. Incidence, which means number of new cases, and which was formed, number of new cases where the patient was infected in a particular time period. Clear? Fine. So what is incidence? The number of cases. For example, I can just simply give the example, like from 2020 till 2022 December. So if I would collect the I can select the duration as 2019 December till 2022 December. How many cases total infected, and what is the new cases? For example, if I take the entire case and then I'll take a particular time period. In this year, 2022, how many new cases were reported? Or we could say like after vaccinating everyone, how many new cases have reported again? Okay, so this is something, it is indicating incidence. Okay. And what is prevalence? Prevalence is number of existing cases over a period of time. Okay, so how many number of cases are there over a long period of time? So incidence, how many number have reported as new case, and prevalence is total number of disease in a longer duration or for a over a long period of time. Clear? And incidence can be usually performed by performing cohort studies or randomized controlled trial method. And this is all we normally, it is included in community research. And prevalence, which is existing number of cases. How many total number of cases are there that is currently existing? Okay. And at the particular point of time, over a period of time, estimated from a cross-sectional or a case control studies useful for planning healthcare services. Okay, so this is prevalence. So prevalence, you can just remember, it is total existing number of studies. Incidence is a new cases of disease which was developed over a period of time. And then now you select the answer. Yes, please. Now you can select the answer. Do we need to select prevalence or incidence? See, here our focus is to prevent death. So how many were infected and how many expired their life? Okay, so how many were total infected and how many just expired? Fine. So you need to focus that. So now we are not at all focusing new number of cases. So C and D can be removed. So increase prevalence and decrease prevalence. So current number of cases, for example, among last 6 months, total number of cases are recorded as 12,000. Clear? And even now, it is 12,000 or even more than 12,000, which means the previous diagnosed persons have not expired, or they are not died. Clear? And suppose the total number previously it was recorded as 12,000 and currently it is only 11,000 now, which means 11 were died, or sometimes the half number of maybe like completely recovered, or the half may be died. Okay, so increased prevalence, that means the total number of infected person are high, which is indicating that no one have died. But decreased prevalence, that is indicating either many were really what is that, cured from the disease, or it can happen as many were died. Okay, so it can be because of two things. That is, decreased prevalence is indicating that number of person have number of cured persons are high, or the number of death are high. മനസ്സിലായോ? So ഇവിടെ ഏത് വരും? ഇൻക്രീസ്ഡ് പ്രിവലൻസ് ഉണ്ടാവുമോ, ഡിക്രീസ്ഡ് പ്രിവലൻസ്? ഇൻക്രീസ്ഡ് പ്രിവലൻസ് എന്ന് പറഞ്ഞാല് ടോട്ടൽ എത്ര ആളുകൾ ഓൾറെഡി ഇൻഫെക്റ്റഡ് ആയിട്ടുണ്ട് അതിങ്ങനെ കൂടിക്കൊണ്ടിരിക്കുക. അതിന്റെ അർത്ഥം എന്താണ്? അതിനകത്ത് ആരും മരിച്ചിട്ടില്ല, അതുകൊണ്ടാണ് അത് കൂടിക്കൊണ്ടിരിക്കുന്നത്. ഓക്കെ, ബട്ട് ഡിക്രീസ്ഡ് പ്രിവലൻസ് ഇൻഡിക്കേറ്റ് ചെയ്യുന്നത് ചിലപ്പോൾ അതിനകത്ത് ആളുകൾ മരിച്ചതുകൊണ്ടായിരിക്കും ടോട്ടൽ നമ്പർ കുറഞ്ഞത്, അല്ലെങ്കിൽ അവർ പെട്ടെന്ന് ക്യൂർ ആയതുകൊണ്ടായിരിക്കും. ബട്ട് ഒരു അസുഖം വന്നിട്ട് പെട്ടെന്ന് ക്യൂർ ആവുന്ന ഡിസീസ് ആണെങ്കിൽ കമ്മ്യൂണിറ്റി ഹെൽത്തിൽ റിസർച്ചിലൊന്നും വരേണ്ട കാര്യമില്ല. ക്യൂർ ആവാത്ത ഡിസീസിലാണ് യൂഷ്വലി നമ്മൾ കമ്മ്യൂണിറ്റി അഫക്ട് ചെയ്യുന്നത്. ഓക്കെ, സോ any doubts? So which one is the correct answer? The correct answer is A, increased prevalence. Again, I just wanted to focus. Prevalence is a total number of existing cases. Clear? And incidence is number of new developed cases. Clear? So you have to focus prevalence, and increased prevalence is indicating no group of persons are died. But decreased prevalence, that is indicating two things: immediately recovered and died. And I don't feel, or I don't strongly agree the communicable disease or the community health. And basically, whatever disease we normally focus on community health, those disease will be considered as a communicable disease, and it will have a long persistence. Okay, if we take any kind like disease like pulmonary TB, COVID positive, influenza, HIV, all these diseases are not like cured within a week or 2 months or 1 month. Fine. So next question.